Medicare for All, or any other way of covering everybody in the U.S., is impossible unless we could do it for less, way less, than healthcare costs us today. What? Hey, brothers and sisters, Joe Flower here with another episode of How to Amaze Your Friends by Actually Understanding Healthcare. Today's episode is, wait, what? Medicare for All? For less? Now, people assume that it will cost vastly more. Like billionaire Michael Bloomberg said that it would bankrupt America for a long time. Like Venezuela, he said. You want that? No, they do more than assume it will cost vastly more. People insist. They get really mad about it. There are lots of ways to get called names online. This is one. One person recently actually told me that even talking about the possibility that we can do healthcare for much less is immoral. They call it lying, that it's some part of a bait-and-switch chicanery to even talk about the possibility. It's apparently pretty easy to go nuts on a subject like this. But imagine what if for a moment with me. Imagine covering everyone, taking care of everyone, and it costing less than what we pay today. Less for the government, less for employers, less for you, way less. Half or less. How could that be possible? Now, this is really kind of a red pill moment, because once I lay this out for you, you really can't unsee it. You won't be able to go back to the usual way that most of us see this debate. If you have watched other videos on this channel, some of this will be familiar, but hold with me for a moment while I lay it out for the people in the back there, the ones who just came in. I'll start with 4 basic facts that are not controversial, that pretty much everyone who studies the U.S. healthcare system would agree are true. 1, the whole thing costs us about $3.9 trillion per year. That's what the government pays, employers pay, you pay, everything. That is a lot of money. It's twice as much per person as any other rich country pays. Even though Americans actually go to the doctor less, go to the hospital less, stay there for shorter times, that's about 5 times what we pay for the most powerful military in the world. Okay. Second, a big chunk of that is wasted on doing things that are really not necessary. More scans than necessary, duplicated tests, colonoscopies and mammograms as first-line screening tools, replacing heart valves on people who are dying from other causes, new knees and hips in frail, elderly, bed-bound patients. I kid you not. It is rampant. There's a whole website about it called Choosing Wisely, put together by doctors about their own fields, that would help you see whether you really need what is being recommended. How much money is wasted this way? Doctors asked about waste in their own specialty will typically say it's maybe 20%. Most studies say something closer to 35% for the whole system. Some of the most comprehensive studies say more than 50%. So that's somewhere between $1 and $2 trillion every year flushed away on stuff we don't need to do. Let's stop for a moment to focus on this. With that kind of money, could we pay for health care for everybody in the U.S.? Of course. While we're at it, we could pay for everybody in the entire rest of the world if we leave out the other top 5 healthcare spenders with what we waste in the U.S. Pretty amazing, isn't it? Okay, third. The great majority of this nearly $4 trillion is spent on categories of disease that are chronic, like diabetes, that are behavioral problems, like opioids and other addictions, like self-harming, that are environmental problems, like lung cancer from secondhand smoke, or young people living in an atmosphere of gang violence. What these all have in common is that they are, to some extent, preventable and have been shown to be manageable in ways that keep them from becoming acute, from requiring hospitalization and surgery. We know how to do that, actually. From pilot projects in particular parts of our system, from other countries, we have a pretty good idea how we could lower the incidence of these disease states, help people from ever getting there, and lower the intensity so that people don't die or suddenly need very expensive emergency care, surgery, hospitalization. The second thing chronic behavioral and environmental diseases have in common is that this prevention and management is almost always way cheaper than hospitalization and surgeries. The third thing is we don't do this prevention and management. Across our system, we pretty much just don't do the things that we know we could do to keep the costs low and greatly help people at the same time. Well, how much does our current approach to these problems cost us? Different experts define the problem a little differently and come up with different numbers. Some say it's more like 70%, others 85% or 88% of our healthcare dollars spent on these problems, but all agree it's a lot. It's a majority of the nearly $4 trillion. Now, if we could reduce that cost by half, or even 25% by smart management, we are talking hundreds of billions to $1 trillion or more per year saved. Costs would come down. Wait, we're not done yet. Fourth, all this is based on the prices we pay for healthcare in this country right now. Not just for drugs, for everything, surgery, births, you name it. Prices are double, triple, 5 times the prices in other wealthy countries. And prices in the U.S. are wildly inconsistent. The price paid for a given procedure or test may be 2, 5, even 10 times the price paid in the next county, the next block, even in the next bed, depending on who's paying. So, obviously, these prices are not supported by anything. They're just made up. They have no relation to any real market price or to the cost of doing the test or procedure. None. And no relation to quality, really. Sometimes the best places are the most expensive. Most often, they're not. Places like Mayo Clinic, Cleveland Clinic, Johns Hopkins, they're not the most expensive at all. Economists studying the increasing cost of healthcare in recent years largely conclude that they are not going up because people are using healthcare more. They're not, really. Or that we are covering more people. That doesn't make that large a difference. No, the number one driver of a higher cost is just higher prices. So we are not only paying for waste, stuff that doesn't need to be done, we are overpaying for everything. Way overpaying. Nuts. So you see where I'm going with this. The loudest argument against doing healthcare for all, doing Medicare for all, any other kind of universal system is that we can't afford it. The system is already breaking our backs. How could we possibly pay for more people? But what if the tremendous costs of the U.S. healthcare system are not because it's the greatest system in the world? What if the costs are mostly bogus? All because of waste, price gouging, taking care of chronic disease as inefficiently as possible, artificial scarcity, to name a few factors. What if smart system redesign could result in a system that is not only better, but costs half as much or even less? Then of course we can afford to take care of everyone. A smart system redesign, That would mean looking at the current system and asking, what is allowing it, compelling it even, to be so expensive? And then rejiggering the system. The system we have just pays for treatments. Find a disease and fix it. It's fee for service. That is, a fee for each individual service. You pay for each test, each procedure, each visit to the doctor. You may think you're paying for a birth baby, a fixed heart valve, a healed wound, but usually you are not. You are paying for each individual thing. So, of course, the system will find as many ways as possible to do more tests, more visits, more procedures, and the system does little or none of the many other things that could be done to make us healthier, prevent disease, manage it when it does show up, minimizing the expensive surgeries, procedures, and high-end drugs. And the system we have has almost no transparency. We have almost none of the fundamental information that anyone needs to make smart choices. Not we consumers, not the big buyers like employers, pension plans, or unions. You can't shop because you can't find out what's good or not. You can't find out how much it costs, especially how much it will cost you. Much of the business is built on opaque, secret contracts between health systems and insurers. How secret? This will blow your mind. Doctors themselves often have no idea what they will get paid for a procedure until the check arrives. The numbers in the contract they signed are often secret even from them. Big buyers and health plans are forbidden to find out what other buyers pay for the same service. Our system is built on monopolistic practices like healthcare systems requiring the insurer to contract with the whole system and not just the one part they need. There is a huge array of common practices, many of which, to me, look like little more than legalized corruption that allow everybody involved in this game to jack up the costs and take a bigger and bigger cut. Here's one little example. That $3.9 trillion for healthcare this year alone, that 1%, about 1% of that goes to just one item, dialysis, where your kidneys fail and they put you on a machine several times a week to pump you clean. It's a $40 billion industry dominated by a few large firms. Now, do you or anyone in your family have chronic kidney disease? What they won't tell you most of the time is that there are successful ways to keep kidney disease from progressing to a need for dialysis. There are other ways, other types of dialysis that are cheaper. There's a whole different world of possible treatments. But people tend to get funneled toward dialysis and toward dialysis programs that are funded by insurance rather than by Medicaid. Why is that? Because Medicaid pays $260 for each dialysis treatment, while private insurance is forced to pay 10 to 20 times as much. That is why these companies spent over $100 million in the fall of 2018 to defeat a ballot proposition in California that would have ended those practices. In the kidney disease biz, the only big pot of gold is in the dialysis business. And that pot is huge, 20% profit on that $40 billion. Remember when a lot of insurers pulled out of Obamacare because they got blindsided by unexpected number of high-cost patients? This is who they were talking about, end-stage renal disease patients on dialysis, and these firms raking in the 10 to 20 times higher private fees for them. Well, this is just one example, a little $8 billion profit example, but emblematic. Study the industry the way I have for decades, and you'll see example after example until you come to believe that these are not aberrations. These are the way the industry is built. All across the industry, every sector tweaks the system every way they can to get themselves more money and power and reach, for profit or not. There are obvious tweaks like jacked up drug prices, many not so obvious ones like dialysis. So, what if we flip these? Outlaw the monopolistic practices, the opaque contracts, the surprise bills, the hidden charges. Can be done. Has been done in other industries. Seriously, can you think of another industry where they can come after you after the whole deal is done and say, oh, by the way, that house remodel, that engine rebuild you bought, that landscaping on the backyard, here's another bill, another $25,000 that we never mentioned before. You have to pay it out of your own pocket. There is no reason that healthcare should be able to do that, ever. And they do it all the time. Outlaw these weird, secretive industry practices, and costs will come down. Pay for bundles instead of fee-for-service, like one published price for a baby birthing, a new knee, an aortic valve replacement. Pay bundled prices, contracted up front, for everything that can be handled that way, and costs will come down. Publish the prices, and mandate that, like airlines and other common carriers, they are the same for everyone, every payer, every buyer. Costs will come down. Publish quality rankings constantly, such as hospital-caused infections and other markers of best practices. Buyers, like employers, unions, and pension plans, can establish reference prices. They work like this. Say you need a knee replaced. The buyer, your employer for instance, gathers the evidence about processes and costs, then lays out a deal for you. They say, look, here are all the places that can do this with high-quality ratings. We have determined that there are a choice of good places that charge $30,000 or less. Go to any one of these places and we will pay for everything. There's no copay for anything. Rehab, drugs, everything's included. Now, if you want, you can choose the place that charges $43,000. Sure, but that extra $13,000 will be your copay. Do these kinds of things, and healthcare providers are forced to compete on price and quality, and prices and costs will come down. The government and buyers and you and I can start being fierce customers the way we are for everything else, and costs will come down. I'm not making this up. It's already happening in some parts of healthcare, here and there, and for those parts, those costs have come down. Applied everywhere possible across healthcare, such tactics will drop costs enormously. Now, some of these plans that Congress is talking about, like Medicare for America, they start with, why do people have to hunt down insurance, sign up for it, figure out how to pay for it, miss one payment, they're bumped? How about everyone is automatically enrolled? One big advantage, now if everyone is signed up, every healthcare provider has to take the public insurance. The provider can't play off the different kinds of insurance or the insured against the uninsured, and you, the customer, can choose based on cost and quality without worrying about some doctor or emergency department turning out to be out of network. You're covered. Wow, a rational system. What would that be like? If they can't play off some group against another, the industry term for this is cost shifting. Costs will come down. There are lots of ways to puncture the system. Buyers such as employers or unions can build on-site clinics right in the warehouse or office building, free to all employees, no copay. Their choice whether to use this clinic or a doctor elsewhere, but this clinic has no copay. It's free to you. Or the employer can contract with direct pay primary care teams at $25, $35, $50 per employee per month for comprehensive primary care. Expensive? Nah, way cheaper than paying fee for service for everything. Pay directly for primary care and costs will come down. Public programs can contract with organizations to treat all the people with diabetes in a particular area, for instance, with contracts that actually make more money if they do it better, help people more, keep them from having to go to the hospital or the emergency department. In rural Iowa, for instance, one program reduced diabetes admissions by half, just by hiring more people, local people, to actually talk to the patients, help them get control of their condition. With strategies like this, costs come down. In some states, Medicaid contractors help people with much more than medical assistance. In Oregon, for instance, one is connecting pregnant teens and young mothers with housing, food, income assistance. In Colorado, a contractor is making sure that people who are on Medicaid and get sent home from the hospital get Meals on Wheels to show up and give them food because they will need help to recover. Or in Western New York, there's a PACE nonprofit that helps frail elderly people with everything at once, from healthcare to nutrition to social contact to housing to transportation, all on a Medicaid contract. They are beginning to do this in some Medicaid programs across the country. And where they do, it works, and it's cheaper, because these programs recognize what are called the social determinants of health. In other words, it's stupid to pay for people's medical costs and do nothing to help them keep those costs down. Where those tactics are used, costs come down. So, is this just soft-hearted talk, playing loose with tax money. No, it's smart management. Let me give you a couple micro examples, things that really happened. There's a pediatrician in a Medicaid HMO. Now that means that the organization the doc works for is not paid fee for service, but per person per year, right? So look at this. He gets a phone call from one of his families. Big rainstorm, roof leaked, ceiling fell in. The 3 kids all have severe asthma already. So if they go back in that house before it's fixed, they'll soon be in the emergency department. They'll be in the hospital. Solution? The HMO sends a crew out to fix the roof, repaint the walls, and clean or replace the furniture and carpets. Kind? Being good humans? Yes. Also, way cheaper than 3 kids in the hospital. Way cheaper. Or, a hospital I know of had a woman who kept coming back to the emergency department in kidney failure because she kept missing her dialysis appointments. She had trouble with the staff. She didn't speak English so well. Her care was not only very expensive, it was very bad for her health. Solution? Send a translator to pick her up and take her to the appointments. Gold-plated treatment? Yes. And way cheaper. Lots of ways. Pharmaceutical companies, for instance, might have to justify drug price rises, like the doubling of insulin costs in just the last 4 years for no reason at all, selling the same products. They might have to open their books for audit. It might be that because our shareholders like it is not enough of a reason to gouge people for life-saving drugs anymore. Drug companies blame high prices for new drugs on their huge development costs. Give me one sound reason that we should just take their word for it. It's Hollywood accounting. No, we could do it differently. What if the government doled out development costs in massive grants, owned the patents, and doled out licenses to produce the resulting drugs to anyone who would produce them? We would still get the innovation, and costs would come down. Pharmaceuticals are as much a part of the national infrastructure as the interstate highway system. What would this look like? Healthcare for half as much. Sounds to most people like a Greyhound bus station with stethoscopes, like flea market surgeries, like drive-through birthing centers. No. A lean, transparent system catering to fierce customers of all types would feel quite the opposite, offering more care, earlier care, even what might feel like lavish care, but earlier in the illness, and more conveniently. Why will providers make healthcare so convenient, personal, early? Because if they are paid to be responsible for your health, paid to make and keep you healthy, it's worth it to them to make the extra effort and investment to catch a disease process early, before it gets expensive. Changing the fundamental business model of most of healthcare will be difficult and painful for the industry, and this will be as politically difficult as any other serious attempts to reform the system, simply because doctors, hospitals, pharmaceutical companies, health insurers, all are formidable political players with big political war chests. But if we look to other countries and say, why do their systems cost so much less than ours, even while they take care of everyone? Why can't we have what we want and need at a price we all can afford? This is the answer. Don't let anyone tell you that we can't do this in America. We can. There are lots of ways. If we get mad enough to change the laws, to win the lawsuits, to back the politicians who are willing to make the tough choices, to puncture the system in myriad different ways, and take it back to serve us, the owners and operators of these human bodies, and our families, and our communities. Change not just who pays for healthcare, which is really all the universal healthcare question is about, but also the way we pay for healthcare and what we're paying for. And we can rebuild the system to be at the same time better and far cheaper.